to, we're getting some of these, we call them rubber stamp denials. They just pull stuff out to see to what degree we're going to resist or contest. Now, this happens before a deposition. It happens before an independent medical exam. So I'm curious if that's to what degree and what approach to contest these things, or keep working and do what we do and let it play out, in whether it's a deposition or a jury or whatever. I guess I'm curious, what degree do we contest early in that phase?
Yeah, that's another good question. And one thing that you have to remember is the attorney generally does not know. And a mistake the chiropractor makes is he thinks the attorney has the judgment and the knowledge whether to push a case or not push a case. And only the A attorneys are pretty good at that. The C attorneys are not at all, and the B attorneys is like hybrid knowledge. And so the point is, number one, the chiropractor cannot just leave it up to the attorney thinking the attorney knows whether to push this case or not. He does not. The attorney knows the obvious stuff. Is there a broken bone? Is there a disc bulge? That's the only thing the attorneys know. They don't know all these other factors that we document with overpressure, restrictions and limitations, joint dysfunction. They don't know any of that. So the answer to your question is, it gets back to you educating your attorney, saying, this is what we have. This is what we have at this point in time with this patient. And when I say this is what we have, I'm talking about the 5 major financial driver categories and the 6 steps to tell the story and win the case, as well as how to defend the case. So I'm going to look at this case when that insurance company does this and rubber stamps it, and I'll say to the attorney, and I'm just going to go right through the checklist, Mr. Attorney. I'm going to tell him, what injuries do we have documented objectively with X-ray, motion X-rays, whatever? How does that relate to an impairment rating? Do I have an impairment rating? Do I have, and then I'm going to go through, after the impairment rating, I'll go through loss of enjoyment of lifetime activities, duties, or interests, but chances are you did not do those at this particular point because those are in-game, those are finality impairment rating indexes. So what I'll also do is I will review the positive findings in the 4 to 5 major diagnostic categories. What are the 4 or 5 major diagnostic categories in chiropractic and personal injury? Well, number 1 is range of motion. But we have 3 ranges of motion. And I'm going to inform him of all 3 and what that means. Active, passive. So do we have positive findings in overpressure? Do we have joint dysfunction? Do we have altered arthral kinematics on spinal x-rays? Then I'm also going to go into the muscle testing. Chances are you won't have much there. You may have a little weakness from pain. Then I'm going to go into the neurologicals. Chances are you won't have anything there. If anything, it'll be subjective. Chances are you will not have anything objective. And then the orthopedics, and chances are you will have either compression or extension orthopedics. And then you'll have the x-rays that also will support joint dysfunction or altered arthrokinematics. And if you have any other supportive evidence that's common, like inflammatory blood indexes, high C-reactive protein, sedimentation rate, if you've done that, or if you've done an NCD-EMG, like I said, chances are there's nothing there. Or if you've done an MRI. So I'm just going to go through the 5 major financial driver categories of where this patient is at this point in time, and then let him know what we have. Say, we have this, we don't have this, we don't. And now you should be able to start making better decisions on how much to push this case. In other words, how valuable, how much time and energy should you or the attorney take? Well, the more that you start filling up those financial driver categories, If you have altered their signal motion, you already have an impairment rating, so now you got two. Chances are you may not have loss of enjoyment of lifetime activity. Chances are you have duties under duress. That's overpressure. Well, now I'm at 3 out of 4 of the major categories. Now and let's say if the case is at the end, because it may not even be at the end at this point, but if it's at the end, I can be at MMI and have the impairment rating and the need for future care. Well, now I definitely will have 4 out of 5 categories. And then how to tell the story. And that's why it's so important to be able to know how to tell the story, take that documentation and tell the story. So number one, can I say, in telling that story, can I say with that data, can I say this was a mechanism of injury, and based on this injury, in my opinion, it definitely caused this injury. And I'm going to pay particular emphasis into the magnifying factors that we talk about: defenses up, joints locked out, whiplash injury, 3 big ones, besides the other 5 other additional magnifying factors. Then I'm going to go to the second part of the story, into subjective and objective findings. Then I'll go into the therapeutic protocol and the response to treatment. And now I'll be at MMI. And that's what I'm going to tell my attorney. And that's what you need to start getting used to, is just walking through the checklist of the financial drivers of what you do and do not have. And that's what will determine how much you push the case. Because the attorney will not know anything that I just told you, except typically if there was a positive MRI. And that's it. I mean, that's all they're used to getting. You know, if they get anything, it might be a positive MRI with a disc bulge, and that's it. I got one attorney I talked to, he said, I don't even take a case unless it has a positive MRI. I mean, I could not believe how much, now he has limited time and he can have associates, but I could not believe how much business he was walking away from when these patients came to him with soft tissue injuries, just because he didn't know how to document it. He didn't have somebody that knew how to document it and support it. And that's called potential. But anyway, it gets back to the core of your question, is a lot of times they will float these rubber stamp statements out there like what you just said, and they'll test you. And so how much you test it is based on your financial driver categories. The more of them you have in more categories, the better. The less you have, not as good. And it might not be worth. You know, there's plenty of times I told the attorney, I said, you know, out of all of these categories, you maybe have one. I said, and I would just say, I just try to settle for the best you can and move on. I said that many a times to my attorneys. And believe me, they trust you. You know, chiropractors are always trying to go in for the grand slam case with the attorney. I'm like, no. What's important is that you show the attorney all the categories and then align that patient with the categories. Now he sees you know how to manage the case, not that particular case, but you know how to manage cases. And that's where you get referrals, not by the one case that you do a grand slam on. So did that kind of handle that, Cole?
Yeah, that answers that question. It's a common practice that I'm seeing more and more of as I'm doing more and more of these PI cases. So I just wanted to be a little bit versed on. You know,
okay, and here's what I would say at this point is stop getting in the reactive mode. The reactive mode. What does that mean?
That makes sense.
It means you got to start doing your initial reports and your medical reports, because that's what establishes the need for care. When you do not do an initial report and you do not do your medical reports that establishes the need for care, that's when the insurance company is going to prematurely softball you this stop payment crap. And so one of the things to slow down that from happening is start quickly just dictating, and I covered this in the PI seminar last time, and is you just quickly do a medical report, just voice dictation. It's just you just follow a little template outline. It's very simple. and you just answer the questions in the template outline and have it dictated, and you send that off. And that's how you slow down these rubber stamp issues. So if you're not sending out initial medical reports, an interim medical report is after the re-exam. You should, after you do the re-exam, you should just dictate off real quickly the re-exam and what the treatment plan of action is and what the course is, and update it. And again, cover how to do the medical reports. And you should have just sent out, that should have been just dictated off and sent out. That takes like 10 to 12 seconds to do the voice dictation of a medical report in a voice dictation. If you're doing voice dictation. If you're not doing voice dictation, then chances are you're making crap, and it's taking you a long time, and it's a real negative thing. And voice dictation is very simple and very easy and very fast. And so, can you see, Cole, if you actually sent off an initial report after the initial exam, a medical report to support your need for care, and then at every re-exam you sent that, can you see how that would slow down the onslaught of the rubber stamping, we're stopping care, of all the guys, as they say, it was pre-existing, there's no need for care, there's no improvement, all the stuff that they say. Can you see that?
Yeah. I'm bringing this point up specifically because this case has come to me from another office where they had junk documentation. So I'm catching it on the heels. So I'm doing a good job up front, but there's already been a bad job done and in front of the insurance. So I'm fixing some bad junk out there.
And even if we talked about this before, that even if with your old bad junk, before you learned, better documentation, how to take that old junk and put it into the story in your you still want to do the medical reports and the interim reports and the narrative reports, but you still you take the junk in documentation you have, and it still follows the formula of the story. Remember, there's two components. It's not just the documentation, it's how you tell the story. If you don't have the documentation and you don't know how to tell the story, you're in the worst possible situation. If you have the documentation, but you don't know how to tell the story, you're still going to hurt the case, even if you have good documentation. You can have bad documentation and know how to tell the story and still do very well. But the goal is to have good documentation and know how to take that information to tell the story. That's how you stop and slow down these IMEs and non-payments and win cases. So if you're not doing the medical reports or the interim reports after your exams, especially for the personal injury cases, you're going to be susceptible to premature rubber stamping and denials of payments and all that. And I'll tell you, it's a lot harder to get that reversed than it is to support it before it happens. It's a lot harder. I would just get in the habit, after you do the initial exam, you spit out an initial medical report. After the re-exam, you just spit out an interim medical report, because what it does is it establishes the need for care and tells the story. That's what it does. And I just got to tell you, if you're doing any other type of documentation besides voice dictation, you're not going to want to do it. And chances are you won't do it because it's a real pain. I've done all that stuff. And the easiest, simplest thing to do is voice dictation. Look at the template. Just look at the template of the medical report. Look at the documentation you have. Put a micro cassette recorder in front of your mouth and just answer the first question on the template to the second, to the third, to the fourth, using the information and the data that you have. And that is how simple medical reports are. But if you're not using medical reports after the initial exam or your re-exams, chances are you're going to get flagged. You're going to get flagged. You're going to get rubber stamp flagged after, X amount of visits or X amount of dollar amount. That's just the way it is. And then chance of you reversing it's going to be much harder It's going to have to go to, there's going to have to be a lawsuit. You're the one that's going to have to tell the attorney what he does or doesn't have to show how much time or energy he wants to put into this based on the factors that we just talked about. And then it's going to go to a deposition, and then either they'll see that you have your stuff and they'll settle, or your attorney asks for more than what they're willing to settle for, and it'll go to court. But it's a bad position to not do the documentation like we talked about, not do interim initial reports and medical reports, and then get rubber stamped with that type of the games the insurance company plays, and you not have the information, especially if you don't know how to tell the story. That's typically when the chiropractor is bitching and complaining that his bill gets cut, insurance, and then he says, how can I stop the insurance? Well, it's the chiropractor's problem. He didn't know how to do the documentation and support the need for care. And so he got the door slammed on him. He got the door slammed on him because of his ignorance.